To the club. Okay. Hi, and welcome to today's episode of Financial Fluency. Today I have Meghan Alonso from Imua Services, and I am so excited to talk to you because what we're going to talk about is pretty close to my heart. So thank you for joining me.
Well, aloha. So good to be on your show.
So, okay, let's first talk about the name Imua and the fact that you said aloha. You have a Hawaii connection here, don't you?
Yes. So the word Imua is obviously Hawaiian, and it means to advance forward with passion despite rough waves. And my company, Imua Services, helps entrepreneurs and startup companies develop new medical technology. And I think it's just the perfect word to describe the whole getting a new product to market, because there's rough wave after rough wave. And with me, I come alongside you and we paddle out together and just master those waves and hang 10.
I love that. And you know what? I've had something on my bucket list for a long time, which is to learn how to surf, because I've always been a little afraid of the ocean.
Yeah.
So that struck a chord with me when you said you'd paddle out next to people. I also have in my family a lot of history of need for medical devices, which is another reason I was really excited to talk to you. I really didn't know that a company like yours existed to help small entrepreneurs and startups with ideas figure out how to get their devices out into the larger world. I'd always thought of it more as like big pharma or, Gore Technologies or these bigger companies. So it's really exciting to me to hear about this.
Yeah. And it's not something that you hear a lot about. I guess people hear the word starting your own business or entrepreneur, and they think something like a franchise or like a local store, local service-based business, or even now like a home-based business. But yeah, that's how medical innovation starts. And it's just kind of like this big food chain where these small companies start up, or technology starts in a lab somewhere at a university, and then it's spun off into a company. And, there's a lot that start each year. And then 3/4 of those, unfortunately, end up failing. But the 25% that thrive either go to market themselves, or they do a combination of that and licensing agreements, or they also get acquired by larger companies. Because with larger companies, they don't have the capability to really innovate. So their way of innovating is purchasing these other innovative companies and then growing their company that way.
So it's kind of like outsourcing the R&D department, like
Exactly.
having the research and development done by little guys in their garages, and then buy them up. That's interesting. And as you were talking, I couldn't help picturing some really neat things I'd seen lately with 3D printing and prosthetics.
Oh, yeah.
People trying to make them really artistic. I wish I could remember the company I was thinking in particular, but there was one where it was the leg for a woman who'd been a dancer and was lost in a car accident. And they decided to make the leg itself this kind of work of art with, I think the material was red, and it was kind of like had lacy bits to it. And it looked completely different from the old sort of mannequin style leg. And obviously that's aside from what you do, but it just made me think of the idea of someone taking technology like the 3D printer and being able to make things that we could never really make before. Has that affected you working with people, having these sort of access to new ways of manufacturing stuff?
Definitely. And 3D printing with medical devices is absolutely huge right now. And there's a few ways that technology is used. So what I see it used for the most is in the prototyping stage. So you're able to quickly and easily produce something that can give you the look and feel of a manufactured part. But if you think about it, do you want to go into high volume manufacturing, like millions and millions of parts per year on a 3D printer? So that's not the most scalable method. Usually someone would go to something like injection molding for that. But early on, they definitely are doing testing and just getting user feedback and showing their investors. So kind of show and tell, like, hey, here's what the product would look like. Do you want to invest? 3D printing is definitely awesome for that. And then with the dancer's leg that you mentioned, that's more of the actual manufacturing. And where that comes into play is custom things like that, to where this is the size of my hand, and I'm 3D printing. I'm just using this as an example. So my hand is going to be different than your hand, than someone else's hand. And so you can't 3D print. Well, I guess you could 3D print one standard size, but it just wouldn't look right. So want to use 3D printing as manufacturing for something like that. And there's all kinds of awesome materials, everything from all kinds of plastic resins to metals to soft materials. And then if you listen, let's see, what episode was that? I think it was episode 2. It might've been episode 2. I have a really cool podcast on 3D printing prosthetic legs for dogs. There was a YouTube video that went viral about Derby the dog, and it shows his story. And at the tail end of that episode, we get into 3D printing technology of foods. And so you can even 3D print chocolate and cakes and all kinds of stuff. So for those of you watching or listening, if you want to hear that episode, it's my podcast is called Inspired by Imua. And actually I could look it up. I think it's episode 2.
I just started to, and then while I was doing that, the sound quality went down just a moment, so I turned the internet off on my other computer. I'm rural Arizona, so every now and then I have internet speed quality issues. So I did listen to 2 episodes that are featured on your page before we got started, and that was some of what made me feel really excited about this. And so while you're looking that up, I'm just going to bring up the idea that necessity is so often the mother of invention, and I am really fascinated by your story and would love to hear how your personal experience with medical devices kind of led you into this business, because I saw on your website you've done surfing and you've been an athlete and you've done lots of different things. How long have you been doing Imua, and kind of what made you decide to make this your business?
So, well, I did look it up. It is podcast episode number 2.
Okay.
And you can listen to that by going to inspiredbyimura.com. And so I started the company in summer of 2015. And what led me to start it is I've been working with companies in medical product development now for about 5 years. And I was predominantly working at an engineering firm. So someone would come to us and they would utilize us for engineering. And then as the company grew, we added on services. Like we brought in regulatory affairs and clinical trials and usability to manage all those. And I was in business development. So I covered all of the sales and marketing and being out at trade shows and just meeting a lot of people. And a lot of people with ideas would contact me, and I could just tell right away that they were really passionate about what they were doing, but they either didn't have the funding that they needed to work with us, or their business wasn't to the point where they were ready for that, or a combination of both. So I started this basically kind of this cut and paste email, because I found myself doing it so many times, to where I put together a resource list and kind of some pointers to give people to get to the place where they could work with us, and then let them go on their way. And then I would check in with them every 6 months or so to just see where they were at. And it started happening more and more. And I really enjoyed talking to these people. And, I realized, okay, they're not the clients that are going to make me money right now, but they can be. So I want to help nurture that. And it just kind of turned into a business from there. And so I'll back up even more. Before I was working in medical product development, what got me there is I was working in orthopedic rehab. So I worked with patients on, it could be kids, it could be elderly, post-surgical, a wide variety of patients there. And I worked directly with them. And then I was recruited by a boss of mine, said, "Oh, you would be great in sales and marketing." So she brought me on that side. And it was while I was in the clinics working with patients that I kind of discovered medical devices. It's something that, you interact with as a human, but you don't really think about some jobs until you're just exposed to what goes on and what you see. And at the same time, the economy was going downhill. We were in the recession. And then a few years later, all the healthcare changes started coming up, and I could just see the writing on the walls that being in private practice is just a really tough thing to do. So I thought, okay, well, I'm really interested in what's going on in here in medical devices. So let's go explore that side.
Well, and you've had personal experience with medical devices
yes.
as well, right?
Yeah. So personally, well, I've had quite a few different things going on. So in my body, I actually have a prosthetic left eye. So this is not real. It's a plastic. Here, I can get closer to my computer here.
It's a pretty amazing match.
Yeah, you can see it. You know, if I look all the way to one side or the other, or up, you could probably see that it's not exactly right, but it's pretty darn close. Mm-hmm. So I have that. And despite me being a collegiate gymnast and a salsa dancer all over the world, I have really bad back problems, and I had a hip surgery. So I have an implant in my hip. And one of the most special experiences I have was we went through some really hard times when I was in high school. My brother got extremely sick, and no one knew what was going on with him. And they tried every blood test, and then finally he came back positive with hepatitis C. So the protocol for that is they just test the entire family, and they found out I had it and my mom had it. And so it was kind of this mystery of, okay, why do 3 of your family members have it, 2 being kids? And so they think the theory is that my mom got it from a blood transfusion in 1974 and then passed it to us at birth. And fast forward, there's been some amazing medication and just innovation in that area. So thankfully we're all cured, but it was a really tough road. We went through 7 altogether. All of us went through 7 different low dose, just nasty chemotherapies to get rid of it. And the really special part for me was some good family friends of ours are neighbors with one of the scientists that worked on the drug that basically saved my life. And that was just really cool. I got to meet him, and it was really cool for me to meet him. And then he really enjoyed that too, because he said, I'm in the lab all the time, and I don't ever get to interact with patients. And it just made that connection so much more special for him and gave him the inspiration and just drive to do what he does every day. So I keep those experiences in mind, and I want that for the people that I'm helping. So the person that maybe their son is going through a big medical issue and they have an idea for something, they have that drive, they have that passion. But the person that does work in the lab, or maybe they just have a good business idea, to really just connect them with the ecosystem and the patients that they're actually helping. It's just such an amazing human experience.
That is fantastic. And I have to admit, when I was listening to your podcast earlier and hearing you talk about medical devices and different things, I couldn't help thinking about times when we have trouble with my daughter Tallulah's feeding tube. She has a white blood cell disorder and can't process protein. So and all of a sudden I was like, oh, could I just invent a medical device? Could I improve this system of like how we do tube feeding and the problems with the site, the stoma, and these different things? And I couldn't help suddenly wondering like how often it is someone who deals with it every day and who encounters these problems that does come up with an innovative way to solve one of them, as opposed to someone who's in the lab all day. Mm-hmm. I imagine you've seen both probably.
Yes. Yeah. And a lot of people are in your situation, or maybe they had knee surgery and they want to, I don't like this device. Yeah. And so isn't there a better way? Well, I'm going to invent something. I just do it. So I do meet a lot of those people, but the process of getting a device to market, Well, number one, it's hard if you do know what you're doing. And so
Right.
if you don't come from that background of, okay, I know how to be an engineer, I know how to be a business person, I know how to get a product to market in the medical device space, it can be really intimidating. So a lot of people just put their ideas on the back burner, but there's actually several different ways that you can move your invention forward without I have a process of, okay, let's do this. Let's test this idea. Let's move forward. And that way you're not spending a ton of money up front. I do encounter some people that think, oh, I think I have this great idea. And then the first step they do is to go out and get a patent and spend $20,000. And I think, oh no.
Does a patent cost $20,000?
In some cases, depending on what you're patenting, it can.
I had no idea. I was thinking like
involved. So not the patent itself, but just
okay.
for the intellectual property lawyer to work on it. So I don't mean to scare anyone when I say that, but I'm using that as an example of what not to do. So.
Right. And you don't really want to patent something that doesn't actually work. I mean, you want to have testing done and have gotten through at least a significant stage, I would imagine. So if you get the patent, but don't have the wherewithal, the knowledge, the industry connections and things, do you sometimes recommend people just sell their patent to someone else?
You can sell the patent, or if your idea, it's more than a fundable product is more than just having a patent. So you want to make sure that there is a market for it, that people want and need it, that you can position it well, that you have a good regulatory strategy for how are you going to get this through the FDA here in the US at least? And then what does the product look like as far as insurance reimbursement, which is always changing. So that's another challenge in itself. And then essentially how are you going to get it to market? So now I forgot your original question.
Oh, I was thinking if you sometimes recommend people just to, get the patent and sell it on to somebody else.
Yes.
Or license it or.
Yeah. So there's things you can absolutely sell your patents. There's also companies out there that if maybe you're a doctor or a nurse and you see this great need and you think, well, I love being a doctor, I love being a nurse, I don't want to do this as my full-time job, is make this product a business. So there's companies that if they think your idea is a good idea, then they'll take your idea and run with it, and then you get royalties. And then you can also develop it to a certain point and license it or sell the product, or if you want to, you can take it all the way to market yourself.
See, having just been on an international flight where we had to do tube feeding, I'm suddenly thinking also there must be a better IV pole setup. Taking an IV pole on an airplane and setting it up and take it down, and the cleaning of everything in an airplane is really frustrating. Maybe I should make travel packs for people who need tube feeding. See, have you ever heard of James Altucher? One of my favorite ideas that I got from him is this, my 10 ideas a day little waiter pad that he recommends people do. So these are going on my 10 ideas for today, or medical device ideas. But yeah, so growing up in my family, we had a number of interactions with medical devices myself, and I always just thought of it as a given. Like I really didn't think of it as something that regular people had any input on or could improve upon or could have even affect. I mean, you could complain about things to your doctor or something, but it just seemed like this world that was so sealed off from the rest of us, that it's the idea that there is so much innovation and interaction with people using them now, or the possibility of that seems so exciting.
Yeah. And even more so now than ever before, just with the everybody collecting or everybody connecting globally on social media, or just like we're doing, like we're able to have a video call and it's easy. So with that, there's a lot more emphasis on patient advocacy groups and people really connecting over certain causes and actually funding those causes. So maybe you're not the one that has the idea, but you want to see change. So you're part of this advocacy group or you're donating to this group that then funds research. So voices are a lot stronger today, and definitely with patients really needing to stand up for themselves. I think in our parents' generation, it was more so, oh, whatever the doctor says, that's how things are. But now we have a lot of information available to us to educate ourselves. And I know, I guess I'm not emphasizing that we all be those patients that come in and say, I found this on WebMD, I must have this. But you've got to stand up for yourself. And if you know something is not right, then it's probably not right. And despite what one doctor tells you, just don't stop there. So the patient advocacy groups are great for that too.
Mm-hmm. Well, I think your example of 2 children having hepatitis C in an unexpected, when it didn't seem like you should have been exposed to it, and finding it was a blood transfusion. I mean, that kind of thing. I spoke to a woman a while ago who had late stage Lyme disease and had spent years and years going through all these tests to try to make sense of the symptoms when she shouldn't. It wasn't a direct route. And if it weren't for her pressing on and trying to learn more and trying to find out more, she might never have known that, yes, this is a real single illness that I have that causes, neurological and GI, all these effects that normally wouldn't be connected to each other from a single disease. Like, it's kind of amazing how much we can figure out and do when our lives and lifestyles are at stake.
Yeah. So this is totally off subject, but it's really cool if anyone out there watching or listening is interested. So there's an NPR podcast called Radio Lab, and there's an episode called Alpha Gal. And the episode is all about this medical mystery of this girl saying, like, I'm sure that I all of a sudden have this allergy to red meat. And she just loves meat. And then all of a sudden she just gets sick eating it every single time. So the podcast is dissecting all these details and then what actually led to this, and this other researcher putting together all these clues. And yeah, if she didn't push for that, then no one would ever find that out, because she definitely had people telling her, no, that's crazy. Like an allergy to red meat does not exist. But it wasn't necessarily an allergy. It was something else displaying as that. But yeah, so if you guys are interested, then that's a really good episode.
I like learning about medical mysteries. I mean, actually, my daughter's white blood cell disorder was a medical mystery because she'd really had it since birth. But we thought her pyloric valve had closed at one point. I mean, she had this like exorcist style projectile vomiting that we just, once I weaned her, everything got worse and worse because we didn't know she couldn't have milk, wheat, peanuts, tree nuts, fish, shellfish, and here I'm trying to give her peanut butter and milk and she's, but because she also had autism, the symptoms that the most alarming autistic symptoms that we had, which was, sometimes we'd have screaming 10 hours a day, self-injury, biting, hitting her head, all these things. When we found out what she had and she was taken completely off of food by mouth, which was a horrible time in many ways, but once she was on an elemental diet and none of those reactions were being triggered in her, all of those things that they told us, oh, that's just autism. That's lots of autistic kids just scream. Yeah, lots of them hit their heads. Lots of them bite themselves. All of those behaviors disappeared. And we realized that was her being in pain. Like, yes, she does have autism, but when she's in pain, she screams and she bites herself and she hits her head. And when she's not in pain, she didn't do any of those things. So it was, it was almost like the autistic, what people assumed was her autism was cloaking this other secondary, well, it wasn't even second. I almost think the white blood cell disorder is primary, and it was just being hidden by autism because every surgery she's had, every time she's been in the hospital, all of the rest of the therapies we do regress. Everything else is affected by her medical well-being, which I think is true for all of us. I mean, anything else about your life is not as good when you are ill, when you're physically ill.
Definitely. Yeah.
So if anyone listening to this is interested, fascinated, wants to know more, where do they find you, and what services do you provide? How can you help someone with an idea?
Sure. So first of all, I mentioned earlier, my podcast is inspired by Imua. So just inspired by imua.com. And that also gets you to my website for Imua services. But the people I really help is anyone that has an idea for a medical product, whether it be someone at home, a stay-at-home mom, just an average person, or maybe you're a scientist that's worked off grants for a few years and you know how to get a research grant, but you don't necessarily know how to bring a product to market. I've worked with students, with entrepreneurs, with people that have already started a company around their idea, and just help them develop it and then get it to market.
Well, that's fantastic. I am sitting here being like, my tube feeding travel pack. I may come to you about that. We'll have to see. Yeah. Okay, great. And I do think that a lot of the audience is moms. There are definitely some moms with special needs kids. So who knows? Maybe someone's been sitting on one of these $1 million ideas thinking, it's impossible. I don't have time. I don't know how. Who do I know to talk to about a medical device? Now you know. You can come talk to Meghan Alonso, and we will put the details for your website and your podcast here. And so if anybody does want to find out if you can help them, they just email you through your website. Is that the best way? Okay. Fantastic. And thank you so much for joining me here. It's been great to hear about your story and your company and all that you do for people.
Well, thank you for having me.
Okay. We'll see you next time. Bye.
Okay. Bye.